introduction. I must be honest, it's a pretty difficult act to follow. I don't think Stephen's in the room, thank goodness, because I'm not going to be speed skating down the aisle during my presentation. But I would like to take the opportunity to share with you a really successful case study we did with the use of stabilized hydrogen peroxide, and it was in a warm water system within a healthcare facility. So just bear with me. All right, so at Ecosafe, we look to partner with our clients. We want to simplify the water management journey because we want to ensure that they use their water safely and sustainably. For those on the other side of this, the monitor, I'm particularly high challenged, so I am looking your way, but you're over there. In terms of some of the clients that we work with, these are them on the screen. It's a wide variety of clients. It's predominantly the healthcare and the mining sector, both across all states and territories, but also internationally. All right, so why manage water risk? Now, essentially, there's four drivers in terms of why you would manage your water risk. The first thing is you want to protect public health. You want to make sure your patients, your visitors, your staff are safe within the environment that they work and stay. Obviously, continuity of operations, water quality will impact your operations if it's not fit for purpose or the quality that it needs to be, going through specialized systems within healthcare facilities. Maintenance costs, obviously corrosive and scaling waters will have an impact on the longevity of your infrastructure, so ensuring that you have the right water quality is going to save you some maintenance costs. And then I think the most underrated risk that people don't really consider that well is the corporate risk or your reputational risk. So no one really thinks about that until something goes bad in your water quality, and all of a sudden your facility is in the media, and that's no fun for anyone. All right, so today I'm going to be talking about a hospital, well, about a location in Perth that was originally a lodge hotel built in the 1970s. And then what happened is they decided to demolish the motel component of that facility and turn it into a hospital. So they built a brand new hospital. So that's the brand new hospital over here. This section of building over here, though, and it's the same building over here, is a multi-story building that was the original hotel. So it was turned into some doctors' consulting rooms. So we had a new hospital which opened up in 1986, and the old part of the other part of the hospital was the old part of the hotel, which became doctors' consulting room. So that's a really important piece of information because, as has already been alluded to earlier this morning with those infrastructure talks, we've now got a 50-year-old building, and an old building is going to have a lot of complex pipework, old pipework. It's going to have several alterations, renovations along the process, and that's going to have introduced a number of dead legs. Now, in terms of dead legs, they're a great space for water stagnation. We're not going to get a lot of water flow in those particular areas, which means we're going to have loss of disinfectant residual. Now, those two features, qualities, whatever you want to call them, stagnation, loss of disinfectant, is going to lead to conditions that are going to be conducive to biofilm development. And for those of you that don't know, that's a great habitat for opportunistic premise plumbing pathogens. So Legionella is an opportunistic pathogen, and it falls into that category. And when you've got biofilm and you've got water stagnation and not a lot of disinfectant, you've got conditions that are going to be quite conducive to proliferation of this particular bacterium. The other thing with old buildings is you will have a lot of corroded pipes. You'll have scale formation building up over time. A little bit of useless information when I was putting together the slide. Scale formation actually increases the growth of Legionella by 600%. I didn't know that. But anyway, so along with the corroded pipes, water stagnation, disinfectant or loss of disinfectant residual, you've got a lot of biofilms being formed. Now, biofilms are a habitat for Legionella. They're a great habitat because they will protect the Legionella or the other opportunistic pathogens that live within there, as well as provide them food. So it's protecting them from any sort of forceful water movement. It's protecting them from disinfectant within the water, and it's a great place to live and thrive. Now, the other little tidbit of information when it comes to Legionella is they love temperatures between 30 degrees and 42. So that's the primary temperature where they will just explode in terms of growth. If you can keep your cold water below 20 degrees, you'll still potentially have Legionella, but it won't grow. And of course, if you can raise the temperature of the water up to 60, 70 degrees, you start hitting that kill zone for this particular bacterium. When it's in the biofilm, not really a major concern, provided your biofilm doesn't break off. And when it's free floating in the water, it does obviously become quite an issue. And the reason for that is the routes of exposure. So there's essentially 3 routes of exposure when one can catch Legionellosis. It's going to be through into the lungs via the mouth and the nose. So you can aspirate on maybe a block of ice, or you can breathe in an aerosol through your nose. The other source of route of exposure of getting contaminated water is going to be through your eyes and your ears. And of course, there's direct contamination. If you have an abrasion or a wound and you have contaminated water that goes over that particular spot, that's another route of exposure. But drifted slightly off topic here, so let me get back to what actually happened. So what was the catalyst to us being on site? So unfortunately, quite often it's something bad that happens, and in this instance, it was in early 2022. There was another large hospital in Perth, unfortunately had a fatality, a Legionellosis fatality caused by Legionella in their water system. At the same time, the facility that I'm focusing on today, they were getting high and continued levels of Legionella within their system. So they didn't have a fatality, but of course, because there had been one, the media spotlight was on all healthcare within the Perth area, and that obviously is going to bring them into the spotlight because now they had Legionella in their water, even though they hadn't had a death. So what happened next? Now, it's important, I can put my regulatory hat on. I was in Queensland Health for 7 years in this space, and from a regulatory perspective, it's really important when something like this happens, does the facility have a plan? Is it operating in accordance to their plan? Now, the good news is this particular site did. They had what they call a water risk management plan, and they had a water management team, which is great. And they were implementing the incident response protocols as per their plan. So they were doing everything correctly. The only thing is they still had the Legionella within their system. So we were working with the infection control team, helping them with the monitoring and interpretation of the data they were getting. And essentially, they had a potential systemic colonization of the warm water system. So the system, or the building and the system I'm talking about, was that hotel component. It's that multi-level story building. It's the old hotel. They had a warm water system running through that particular part of the building, and that's where they had the colonization of Legionella. So the immediate intervention would be to raise the temperature. It's a warm water system, so let's push that up to 60, 70 degrees, get some flushing going, clear out as much Legionella as we can. We also had a chlorinator installed on the warm water system to try and boost that residual. And in the interim, that actually worked. That brought the levels down to sort of a manageable level. They didn't have as much, very much an interim solution. And at the same time, the hospital executives at that particular point were able to release some positive media around that. So what happened next? So for the next couple of years, the same building continued to get a lot of detection. So we had I don't want to say the newer hospital, but the hospital component, they had good results, but this warm water system continued to get ongoing detections in the doctor consulting rooms. It's kind of like the spinning wheel of death on your computer, because the management process would be to flush the system, and they were flushing for up to 10 minutes at every positive location they were getting a detection. The intention behind the flushing being to try and bring the chlorine residual through to those endpoints. Now, the one positive thing we did have was we had a chlorinator on site, and you can dial that up. You can increase the concentration, but with that obviously comes the risk of damage in pipework. And so in consultation with the engineering team on site, the advice was not to go higher than 1 milligram per liter of chlorine. So even at that max concentration that we could get it up to, we were unable to get rid of the Legionella. So the situation you have is you have an old building, and there's lots of old buildings, healthcare facilities, and the traditional methods of chlorination, pasteurization, and flushing were just not having any sort of sustained resolution. Largely in part to that very complex old plumbing network that's in these buildings. So that brings me to the stabilized hydrogen peroxide, which we knew was an effective disinfectant. We knew it had been used internationally quite successfully. It's far less corrosive than chlorine in a water system. And it also had the Department of Health in WA had also approved it for use in the drinking water system. What hadn't been done is it had never been tested in a healthcare setting before. And that's where we thought, well, this is the perfect scenario in which to undertake a trial to see if it could remediate the system. So with any trial, you're obviously going to set out some sort of objectives. The first objective was to see whether or not it could remediate, get rid of the Legionella. Could it get it down to a sustained operational period where we were getting no detections? That was the objective in that regard. In terms of the asset, we obviously wanted to try and preserve the infrastructure. So we didn't want to cause further corrosion. We didn't want metals leaching into the water. We didn't want additional pitting. The other variables that we were the other objective was the biofilm. Could stabilized hydrogen peroxide disrupt the biofilm? The biofilm, as I said earlier, is a key driver when it comes to persistence and recolonization by the Legionella. So if you can get the biofilm out the pipe, you're in a step in the right direction to reducing the Legionella within a system. And the last objective was to undertake this task safely. So the hospital didn't shut down. It was still operational while the trial was happening. So it was critically important that the dosing was monitored closely, that we were able to verify the monitoring that we're doing, and the whole process needed to stay transparent from a governance perspective. So what exactly did we do? What was the methodology and the strategy behind it? So the first thing was we obviously needed to have some baseline data, which we had accumulated over the couple of years, because you want to compare the trial to what you had before the trial. The next thing was to devise a sampling plan. Obviously, all the testing was done through labs that were not accredited for those particular tests. Sampling method, so there's various ways you can sample for Legionella in the water system, and however you sample, the interpretation of the result is impacted by that. So we took two types of methods in terms of collecting water. You can take the first flush, or as it's delivered, also known as that, or you can flush the system for 30 seconds and then take a water sample. So those results will give you potentially different results, but in terms of interpretation, you know what the water is related to. So for this particular trial, we tested for Legionella and heterotrophic plate or colony count on a weekly basis. We tested for those metals on a routine basis. And then what you should be doing if you're not doing it is we took a lot of field tests at the same time that we took the sample. So that's going to help with interpreting your results. So free chlorine, hydrogen peroxide, temperature and turbidity were also measured every time a sample was taken. I've alluded to it already, but the peroxide analyzer was critical to this process to manage the concentration. In terms of the strategy now, what did we actually do? We did a shock dose, so an incredibly high dose of the stabilized peroxide into the water, followed by a 4-month period where we just introduced a much lower level of residual. All right, so coming to the end, on any given day in a hospital, this is not what you want to see. But given that we had a trial undergoing, this is exactly what we want to see, because this is the biofilm coming out. So that's great news. That turbid water is the biofilm coming out of the pipework, which is a great sign, and that correlates with some of the data that I'm showing here. Without getting into too much detail, this is the HPC on the left. You can see the purple line actually represents where the shock dose occurred, and you can see that the slightly darker cells are increased in HPC. And so once we did the shock dose, we have an increase in HPC, but then towards the end of the trial, we're getting no HPC. So that's great news from a Legionella perspective. On this side, the shock dose goes in on the purple line, very low, no detections of Legionella during the trial. And in terms of the metals in the water, the metals initially jumped up, but then for the rest of the trial actually dropped to pre-trial level. So in terms of the successfulness of this, it was super successful. It did reduce the Legionella out of the system, which is exactly what we wanted. The biofilm removal was fantastic, as shown by those really horrible turbid pictures of water coming out. The other thing that was really a good outcome was the metals in the water. So there was no significant corrosion caused to the pipes, which was obviously the concern with having the chlorinator on site. We didn't want to make a situation worse. Yeah, that is pretty much it in a nutshell. The one aspect and feature I haven't mentioned of sodium, stabilized hydrogen peroxide, is that it's got no smell, and obviously no taste and odor. So that's a really important feature of this particular compound. When you're working in a healthcare facility, from an aesthetic point of view, you can use high concentrations of it without everyone complaining about smell and taste within the water. And that is it.